An ideal age to become pregnant. It is common for couples after marriage, or at least the majority, to hear this question from their friends and families even if they are doctors. My patients usually ask me this question: how old do we need to have a baby? First of all, whether to have a baby or not, as well as when to have one, is a very personal choice. Now, people are getting married into their late 20s or early 30s, and they are planning their careers, studying late, and then finally getting married in their early 30s, sometimes without finding the right partner. The timing is fine, perfectly understandable, but by the time that you get married, does it become late? So let's think about certain biological facts. Is it okay to wait so long to plan a baby? Did you know the right age to conceive is actually between the ages of 18 and 23? According to a book, women find it very easy to get pregnant when they are in their early 20s. This means that she will have an easy pregnancy, and in all likelihood will deliver safely. I know you must be laughing at this point, but now is the time for you to all rejoice about that. It is the last thing on her mind when she has so many other priorities that she has to become a mother herself. She is studying, she is planning her career, and maybe she hasn't found the right man yet. So did you know when a girl child is born, the number of eggs in her ovary is fixed when a girl child is born, but the exact number of eggs varies from person to person. This gradual and steady decline in egg number is what is known as ovarian reserve. A number of eggs in the ovary, 5 to 6 eggs, are produced every month, but only one matures and ovulates, meaning that there is a lot of wasted eggs. As a result, a woman's ovary releases eggs every month, and as the woman's age rises, the quality of the eggs decreases, which reduces the chances of her having babies with genetic defects. Chromosomal defects, trisomies such as aneuploidies and Down syndrome, are becoming more prevalent these days, as we also see a very disturbing phenomenon: early menopause in women. This is called premature menopause, or maybe premature ovarian failure. We are seeing women as early as 35 go into premature ovarian failure due to lifestyle factors such as diet, stress, pollution, wrong diet. As women age, there could also be problems in the uterus. As we age, infections in the uterus and fallopian tubes may cause blockages, resulting in infertility and ectopic pregnancy. Additionally, miscarriages and preterm labor are also said to increase with the woman's increasing age, as well as medical complications. Additionally, passing years increases the chances of the mother developing diabetes and hypertension, medical complications that can compromise the outcome of the pregnancy, the baby's health, as well as the mother's health. There is also evidence that with age, the chances of operative deliveries and 7 sections also increase. In contrast to women, men continue to produce sperms until late in life, but by age 35 or 40, the quality and quantity of sperms drastically declines. Pollution, stress, wrong diet, drugs, and alcohol intake, and also the quality and number of these sperms may also deteriorate these days due to pollution, stress, and problems with diet. Male infertility is also on the rise due to the smoking, drugs, and alcohol consumption. The Wiki Dodo is a funny and popular movie that we can't forget, so what should be done is to keep in mind that the ideal time is when you are prepared physically, mentally, emotionally, and financially to have a baby. In case you plan to get married late and you want to plan your pregnancy, it is very important that you to discuss this with your doctor. You can always speak to your doctor about the wonderful artificial reproductive technologies available today. We have an easy-to-obtain test called anti-molecular hormone by which we can measure your ovarian reserve. So if your reserve is low and you are planning to get pregnant, the test will help you assess your options for getting pregnant. If you are not yet married or you want to plan your pregnancy later, you can always speak with your doctor about your fertility options. If you're married and don't want to wait, you can do embryo freezing. Similarly, if you plan to become pregnant a little late, it is important that you maintain good health and exercise while eating well and taking care of your body. Before you decide to get pregnant, make sure you don't have diabetes or hypertension, and if you do, make sure they are under control. Stay away from smoking, alcohol or drugs. Please like, share and subscribe.